Welcome to another episode of Rolan Connect. Look at the issue from the grassroots. How do you explain what true equality is and what does it look like to you based on the experience you have so far?
When we talk about health equality, I don't think it's very attainable. But if we're talking about equity, like if we talk about equity, fairness to everybody, I think it's attainable. And when we're talking about health equity, we are not minding their geographical location, their economic status, or their social background, that they are able to access healthcare, they're able to get the treatments that will be able to preserve their health. So that's what we're meaning. It does not mean like, okay, in the urban areas we have modern facilities and we know they are quite expensive. But when we come to the rural areas, we don't have that. So it can't be equal, but at least giving them these basic treatments, basic facilities to maintain their health, I think that's more attainable when it comes to health.
And I think health is like one that is very paramount right now. Underserved communities are not getting enough resources. That one we all know about.
Yeah.
And you see a lot of times people come out to seek for help. The government is trying, but the government is not doing enough. That's why NGOs like Rolan Foundation is making sure to bridge that gap as much as possible. Even though, let's be honest, we can't reach everyone, but we're just trying to like get to as much people as we can. And I believe assistance from donors, from sponsors, from partners will be able to extend and reach more people. What are some of the non-financial barriers you see that keep these people from accessing like healthcare, even when it's technically available? Okay.
So while you were asking the question, you spoke about like their belief system. Let me even start from in fact, we feel like a lot of us live in the cities, a lot of us are educated, but at least statistics show like 70% of Nigerian citizens are actually in rural areas. So their education, there's a very huge margin in education. When it comes to belief, I've always loved going on medical outreaches. I've always loved volunteering, so I think I've had experience for like 5 years, if I'm not mistaken. I know I've been to a community where you bring all these things that look okay, it's good, and you think that people are happy with this, but the belief in that system is like they don't take anything, they don't want to have anything to do with like the white man medicine, so they believe in their local herbs and things like that. So I don't want to mention the place, but the place is in the east, in Anambra to be precise. So there are a lot of communities like that, and people, and some of them, because of their belief, some people will not even want to get there. So there's a lot of health gap, health education gap, and also places to get to. Dr. Eddie has always been talking about you have to hire tractor, you have to hire boats to get to some of these communities. It is real. Like, they are hard to reach communities that before you get there. In fact, then when you even see the financial aspect of getting there to even offer the help, you just say, okay, you know what? I think we should just leave these people for a while. So there are places that are not, basic amenities are not even gotten there, talk less of health. Another problem is even coming from the health workers themselves, because should I say, out of 100% of health workers, 99% don't want to work in rural communities. There's this thing of, okay, I want to be a public health physician, I want to be a community physician. And ideally, their work is actually to be in the rural communities and giving primary health care. But how many people want to stay there? How many people everybody wants to work in international organizations where they are paid good money. So it also boils down to the government and not giving incentives to health workers that would motivate them to go to rural communities. And us that are educated need to educate our neighbors. You gave examples of Nigerians, they give them bag and they go and sell it. NGO will give them bag and then they will sell it. So apart from the government, citizens have a lot of work to do too. The change begins with us, with ourselves. So yes, the government needs to do something. I mean, I literally went to a place where women deliver, and honestly, I was almost moved to tears because this can have complications. It's a lot of the place is an eyesore, but that's where thousands of people are giving birth in. Thousands of people are like they say they have a lot of people that come because it's cheaper. They pay like 10,000 to get delivery, but in a private hospital, in a government hospital, you need like 350,000 to do a cesarean section. It's not subsidized in any way. So a lot of mortality, complications, and whatnot. It's just not talked about as much.
Thank you so much once again for taking our time to join us, Dr. Tochi, and for everyone that's been on this call on this